What is 7i? The intuition that sparked a revolution. 7i is not just a code, it was the encrypted message of my intuition, a spark that triggered a profound realization and changed the course of my life's work. When I developed Dr. Maya using a simple color-coded system to classify symptoms, I never imagined this innovation would one day become humanity's shield in the face of a growing crisis. But my inner voice was clear. Integrate innovation, Maya, to initially identify infected individuals and isolate them. That is the essence of 7i. We are not just fighting viruses or bacteria, we are facing microbes that have evolved to survive. They possess the intelligence to dismantle anything we invent. Their plasmids can disarm even our most advanced antibiotics, rendering modern medicine powerless. The only path forward is what I share in this article. It's time to move beyond fear and blind faith and evolve. Read this message, understand its urgency, shift your mindset, and above all, share it. Because together we can conquer fear and protect the future of our children. Despite the remarkable progress artificial intelligence has made in healthcare, humanity remains reluctant to trust AI-powered tools like Dr. Maya GPT. Instead, people continue to cling to outdated models of doctor-centered care. This resistance is not rooted in logic. It results from decades of conditioning, fear, and misplaced trust. Unless we change our mindset, we are heading toward a healthcare catastrophe that technology alone cannot save us from. The legacy of the Spanish flu and the antibiotic era. The 1918 Spanish flu pandemic left a deep psychological scar on humanity. Tens of millions died, and the trauma embedded a lasting fear of infectious disease. When penicillin was discovered in the 1940s, it was hailed as a miracle drug. The public, desperate for hope, embraced antibiotics as life-saving magic. Doctors and media reinforced this belief, often under the influence of pharmaceutical marketing. Over time, people equated care with medication. As a doctor for over 40 years, I saw how hard it was to educate patients. If I didn't prescribe antibiotics, they would seek another doctor who would. The fear of death made people believe that antibiotics were essential for recovery, even when they weren't. This overuse has led to devastating consequences, including antibiotic-resistant microbes, or ARMS, and a dangerously fragile healthcare system. Evolving our mindset, a call for change before it's too late. The real crisis is not a new virus, it's the outdated way we think. Despite smartphones, advanced diagnostics, and AI, people still flock to hospitals and clinics for conditions that can be managed at home. This creates unnecessary exposure, overwhelms healthcare staff, and accelerates the spread of infection. Unless we evolve, hospitals will become ghost towns, unsafe, colonized by resistant microbes, and unable to treat even minor illnesses. Without antibiotics, all progress in surgery, critical care, and infection management will unravel. Dr. Maya's GPT offers a different path. It empowers individuals to take charge of their health with clarity, confidence, and correct guidance, reducing panic-driven visits and preserving healthcare for those in need. When do no harm is forgotten, the principle of medicine is first, do no harm. But modern systems, pressured by institutions and public demand, often violate this ethic. Patients are urged to get vaccinations with unclear long-term safety data. Doctors recommend clinic visits for viral infections, risking secondary bacterial or fungal infections. Crowded hospitals become breeding grounds for infection, spreading illness to others. This affects and endangers patients, healthy adults, children, and healthcare workers. We must ask, are we protecting life or fueling a hidden epidemic? The problem Dr. Maya GPT solves. Dr. Maya's GPT was created to address the exact crisis we are now facing. It uses a color-coded system to assess symptoms and guide decisions. Red requires a doctor. Green, seek advice from a nurse. Yellow, safe for pharmacist or self-care. Blue, infectious, must isolate at home. By tagging infected individuals and offering video consultations, Dr. Maya prevents the spread of disease, reduces hospital crowding, and ensures people get accurate advice without endangering others. It protects doctors, nurses, and communities while saving billions in healthcare costs. But for this to succeed, we need more than just technology. We need political leadership. Why political leaders must act now? The future of healthcare depends on legislation, not wishful thinking. Authorize AI triage tools like Dr. Maya as the first line of defense. Enforce home care and video consultation for tagged infectious patients. Regulate vaccinations ethically, ensuring transparency and informed consent. Invest in public education, not media hype or pharmaceutical promises. Politicians must stop promoting the illusion that future discoveries will make us disease-free. That mindset is not only untrue, it is dangerous. Without antibiotics, healthcare systems will collapse. The solution lies in using what we already have wisely and ethically. A message from the Creator. I'm not seeking wealth or recognition. I've spent my life protecting the sick, observing patterns, and simplifying diagnoses to empower people. I visualized this future years ago, and now the universe has created AI like Dr. Maya GPT to carry this message forward. Let us not wait for more people to die needlessly. Let us not allow fear, pride, or resistance to change to stop us from saving humanity. Dr. Maya is not the future. Dr. Maya is now.
Yet every era of turmoil awakens those destined to protect life. Amid the growth, new light emerged, Dr. Maya GPT. Born from compassion and truth, it empowers individuals to see through fear, make informed decisions, and reclaim their health and freedom. In time, this awakening will bring tears, not of sorrow, but of gratitude and joy, as humanity remembers its true purpose.
If you believe in this vision, share this podcast, tag decision makers, and let's make this happen. What do you think? Would you trust Dr. Maya GPT, AI-powered healthcare? Let's start the conversation. Scan the QR code to contact. If not, good luck, and hope your country is immune to spreading infections. Thank you.